Did you know that the position you sleep in every night may be quietly putting extra pressure on your heart, slowing down your circulation, and increasing your risk of stroke without you even realizing it? After age 60, the risk of stroke nearly doubles with every decade. More than 80% of strokes happen in people over 65, and the frightening part is that many people do not realize there is a problem until one morning they wake up with numbness in an arm, dizziness, slurred speech, or worse, they never wake up at all. What surprises me is that most people spend nearly 1/3 of their lives sleeping, yet they only think about whether the mattress is soft enough or the pillow is comfortable enough. They never stop to ask themselves, is my sleeping position helping my heart rest or forcing it to work harder all night long? This matters even more as we get older. Blood pressure tends to rise. Blood vessels become less flexible, circulation slows down, and the risk of blood clots becomes higher. At that point, sleeping position is no longer just about comfort. It can directly affect your heart, your brain, your circulation, and even your risk of thrombosis and stroke. The good news is that there is one very small change, completely free, that you can start tonight. A change that may help blood flow more easily, reduce pressure on your heart, ease acid reflux, and support the prevention of dangerous blood clots. And, surprisingly, very few people have ever heard anyone talk about it. Many people think strokes and blood clots happen suddenly, without warning. But the truth is that in many cases, the body has been quietly creating the conditions for those problems for years. After age 60, blood circulation is usually slower than it was when you were younger. Blood vessels gradually lose some of their flexibility. The heart has to work harder to push blood throughout the body. The valves in the veins of the legs also become less effective, making it easier for blood to pool in the lower legs and feet. That is why so many older adults notice that their legs feel heavier in the evening, their ankles become slightly swollen, they experience leg cramps at night, or their feet go numb while sleeping. Many people assume these are just normal signs of aging. But sometimes they are signs that blood is not circulating as well as it should. The problem is that when you sleep, your body stays still for 6 to 8 hours. During the day, every step you take helps the muscles in your legs squeeze blood back toward the heart. But at night, when you lie still for too long, especially in the wrong sleeping position, blood can move much more slowly. That is also why older adults, people who are inactive, people with diabetes, high blood pressure, or excess weight often have a higher risk of developing blood clots. The slower the blood moves, the more likely it is to pool. And when blood sits still for too long, the body becomes more likely to form small clots inside the blood vessels. The dangerous part is that you may not feel anything for weeks or even months. Then one day, that clot can travel to the brain, the heart, or the lungs. And when that happens, everything can change in just a few minutes. That is why sleeping position is not just about comfort. For older adults, it can directly affect how blood moves through the body all night long. Most people assume the heart sits right in the center of the chest, but that is not completely true. The heart sits slightly to the left and tilts a little forward. That means the position you sleep in every night can directly affect how your heart works. When you sleep on your back, especially after a dinner high in salt or fat, the weight of your organs can place extra pressure on the chest and circulatory system. For a healthy younger person, this may not make much difference. But for someone over 60, or for people with high blood pressure, diabetes, or a history of heart disease, even a small amount of extra pressure on the heart can make it work harder for hours at a time. Some people wake up during the night with a faster heartbeat, a heavy feeling in the chest, mild shortness of breath, or the feeling that they need to change positions to feel more comfortable. Many assume it is just part of getting older or simply poor sleep. But sometimes it is a sign that the circulatory system is not being properly supported during the night. Sleeping on the right side is not always ideal either. For some people, especially those with circulation problems or acid reflux, sleeping on the right side may make blood flow less efficient and increase discomfort during the night. The important thing to remember is that your heart never stops working, even while you sleep. Every minute, every hour, it is still pumping blood throughout your body. And if you accidentally choose a position that puts extra strain on your heart for 6 to 8 hours straight, that burden becomes much greater than most people realize. That is why many doctors encourage older adults to pay more attention to sleeping position, especially if they often have high blood pressure, wake up feeling tired, or notice heavy legs or shortness of breath at night. When you sleep on your left side, your heart is in a more natural and favorable position to pump blood throughout the body. This becomes especially important as we get older because the heart is no longer as strong and flexible as it was in younger years. Think of the heart like a water pump that has been running nonstop for decades. If that pump can work under the right conditions, it runs more smoothly, becomes less overloaded, and experiences less wear and tear. But if it has to deal with extra pressure every night, even just a little, that strain builds up over time. When you sleep on your left side, blood from the lower part of the body can usually return to the heart more easily. The heart does not have to work as hard to keep circulation moving through the night. For people who often deal with high blood pressure, heart palpitations, a rapid heartbeat, or waking up feeling exhausted, the difference can sometimes be more noticeable than they expect. Many older adults say that once they start sleeping on their left side more often, they feel like they can breathe more easily, they have less heaviness in the chest, and they wake up feeling clearer and more refreshed in the morning. Some people even notice less swelling in their legs by the end of the day or less aching in their legs at night. Another benefit that many people overlook is that this position may help the body enter a deeper state of rest. When the heart is not working as hard, blood pressure during the night tends to be more stable, the heartbeat becomes steadier, and sleep often becomes deeper. That is what makes sleeping on the left side so special. It may not create a dramatic change after just one night, but if you keep doing it for weeks or months, it may take a great deal of pressure off your heart over thousands of hours of sleep. There is a very large blood vessel in the body that almost nobody talks about, yet it plays a major role in heart health and circulation. It is called the inferior vena cava, the highway that carries blood from the legs, abdomen, and lower body back to the heart. The problem is that this vein sits deep inside the abdomen and can be compressed more easily when you lie on your back for too long or sleep in the wrong position. When that happens, blood from the legs returns to the heart more slowly. Blood is more likely to pool in the lower legs, ankles, and feet. That is why many older adults notice that their legs feel heavier at the end of the day. Their ankles become swollen, their calves feel tight, or they get leg cramps at night. Some people also experience numbness, a burning sensation, or a feeling like something is crawling under the skin when they lie in bed for too long. These signs are often ignored because many people assume they are simply part of aging or the result of being on their feet all day. But sometimes they are a warning that blood is not circulating as well as it should. When you sleep on your left side, there is usually less pressure on the inferior vena cava. That helps blood return from the legs to the heart more easily throughout the night. For people who often deal with swollen legs, varicose veins, or waking up with heavy aching legs, this change can make a noticeable difference in a fairly short amount of time. What is important to understand is that the longer blood sits still, the greater the risk of forming blood clots. That is why people who sit for long periods, stay in bed too much, or do not move around very often are more likely to have problems with thrombosis. And sometimes it all begins because blood is not flowing smoothly for several hours every night. Blood clots are one of the most dangerous things because they often form silently. You cannot see them. Most of the time, you cannot feel them either. But once a clot travels to an important organ, the consequences can happen within minutes. If a blood clot blocks blood flow to the brain, it can cause a stroke. If it blocks an artery that supplies the heart, it can trigger a heart attack. And if it travels to the lungs, it can cause a pulmonary embolism, an extremely dangerous condition that can sometimes take a person's life before they even realize what is happening. What makes this so frightening is that many blood clots begin in the legs. At first, they may be small clots inside the deep veins of the calf or thigh. A person may only notice mild pain, slight swelling, warmth, or a feeling of tightness in the leg. Some people may not have any clear symptoms at all, but if that clot breaks loose and travels through the bloodstream, it can become a ticking time bomb inside the body. That is why doctors are especially concerned about older adults, people who are inactive, people who sit or lie down for long periods, or those with conditions like diabetes, high blood pressure, and heart disease. Nighttime is when the risk often becomes higher because the body stays still for too long. Blood moves more slowly. The legs are less active, and if your sleeping position makes it harder for blood to return to the heart, the risk of developing a blood clot can rise even more. That is also why small changes, such as adjusting your sleeping position, elevating your legs properly, or taking a short walk before bed, can sometimes make a big difference in circulation and reduce the risk of blood clots over time. Strokes usually do not happen at random. In many cases, they are the result of years of high blood pressure, weakened blood vessels, poor circulation, and small blood clots quietly forming inside the body. When you sleep on your left side, blood tends to flow more steadily throughout the night. Blood from the legs returns to the heart more easily, the heart pumps blood to the brain more smoothly, and the risk of blood pooling becomes lower. That is extremely important because the brain is the organ most sensitive to a lack of oxygen and blood flow. If even a small area of the brain does not receive enough blood for just a few minutes, brain cells can begin to suffer damage. And if the problem lasts longer, the result can be facial drooping, slurred speech, weakness in the arms or legs, memory loss, or even the loss of the ability to care for yourself. Some older adults wake up in the morning feeling dizzy, mildly headachy, blurry-eyed, unsteady, or with numbness in their arms or legs during the first few minutes after waking up. They often assume it is simply because they did not sleep well or because of age. But sometimes it may be a sign that blood flow to the brain during the night was not as good as it should have been. The right sleeping position cannot replace blood pressure medication, heart medication, or the treatments recommended by your doctor. But it can create a better environment for the brain and blood vessels to rest for 6 to 8 hours every night. For people who have had a transient ischemic attack, a mild stroke, or years of high blood pressure, paying attention to sleeping position may become a very valuable part of protecting the brain over the long term. Many people think that when you sleep, the brain simply shuts off to rest. But the truth is that during the night, the brain is still doing something very important, cleaning itself and removing waste that builds up throughout the day. While you are in deep sleep, the brain activates a system that works like a night cleaning crew. This system helps wash away waste products, excess proteins, and substances that can cause inflammation or damage brain cells over time. What is interesting is that many studies suggest this process works better when the body is lying on its side, especially the left side. In that position, fluid in the brain tends to move more efficiently, helping waste clear out more effectively. That is why some people feel mentally lighter, more alert, and less foggy after they begin sleeping in the right position. They wake up more easily, feel less heaviness in their head, become less forgetful, and notice that their mind feels clearer in the morning. This becomes especially important with age. As we get older, the brain's natural ability to clean itself slows down. If poor sleep, restless nights, loud snoring, or waking up multiple times are added to the picture, it becomes even harder for the brain to fully recover. You may not notice a difference after just 1 or 2 nights. But after a few weeks of better sleep, many people realize they can focus better, forget things less often, and have more energy during the day. Sometimes the reason you feel tired, sluggish, and mentally drained in the morning is not just because of age. It may simply be because your brain has not had the best conditions to rest and restore itself during the night. If you often deal with heartburn, a bitter taste in your mouth in the morning, a dry cough at night, or the feeling that food is stuck in your throat after lying down, there is a good chance you may have acid reflux without realizing it. This is very common in older adults, especially after late dinners, heavy meals, or lying down too soon after eating. Many people think acid reflux is just a minor annoyance, but when it happens often, it can irritate the esophagus, cause a lingering cough, disrupt sleep, and even affect heart health over time. When you lie on your right side or on your back right after eating, stomach acid is more likely to flow up into the esophagus. That is why many people wake up in the middle of the night with a choking feeling in the throat, mild shortness of breath, chest burning, or a sour taste in the mouth. On the other hand, when you sleep on your left side, the position of the stomach and esophagus makes it easier to keep acid down where it belongs. As a result, acid is less likely to flow upward, and nighttime discomfort often becomes much less severe. Many people who switch to sleeping on their left side notice that they cough less at night, have less burning in the chest, and sleep more deeply. Some even find that they wake up without a dry, irritated throat or the bitter taste they used to have in the morning. Another benefit is that when you sleep more deeply, the body recovers better. Blood pressure at night becomes more stable, the heartbeat becomes steadier, and your mood the next morning often improves as well. Sometimes the problem is not simply that you are getting older and sleeping worse, it is that your body is trying to tolerate too much discomfort during the night without you even realizing it. Not everyone needs to change their sleeping position right away, but there are certain groups of people who may notice much greater benefits if they start sleeping on their left side beginning today. The first group is adults over 60. As the body ages, the heart does not pump as strongly as it once did, blood vessels become less flexible, and circulation tends to slow down. Simply helping blood return to the heart more easily during sleep can already make a meaningful difference. The second group is people with high blood pressure. For them, the heart already works harder every day to move blood throughout the body. If the heart also has to deal with extra pressure at night because of the wrong sleeping position, blood pressure becomes harder to control and the risk of complications becomes higher. People with diabetes should also pay close attention. Diabetes can damage blood vessels, affect circulation, and increase the risk of blood clots. Many people with diabetes often complain about numb feet, burning feet, or aching legs at night. A sleeping position that supports better blood flow may help reduce some of that discomfort. In addition, people who have had a mild stroke, a transient ischemic attack, heart disease, or varicose veins may also want to consider making this change. These are people who already face a higher risk than average, so every small thing that supports better circulation matters. Pregnant women are another group often encouraged to sleep on their left side because this position reduces pressure on major blood vessels and helps improve circulation for both the mother and the baby. And finally, there are people who frequently deal with acid reflux, snoring, swollen legs, or waking up feeling exhausted. If you fall into one of these groups, your body may already be trying to tell you that it is time to change the way you sleep every night. Many people hear that they should sleep on their left side, try it for a night or two, and then quickly give up because their shoulder hurts, their hip feels sore, or they wake up on their back again. That is completely normal. If you have been sleeping in the same position for decades, your body will need time to adjust to a new one. You do not have to force yourself to stay on your left side for 8 hours on the very first night. One of the most common mistakes is sleeping on your side without giving your body enough support. When that happens, your shoulder and hip end up carrying all of your body weight, which can quickly lead to pain or numbness. The simplest solution is to place a thin pillow between your knees. This helps reduce pressure on the hips, keeps the spine straighter, and makes side sleeping much more comfortable. If you often deal with lower back pain or knee pain, this small trick can make a surprisingly big difference. You can also place another pillow behind your back. That pillow acts like a soft barrier that helps prevent you from rolling onto your back during the night. Many people find that adding one pillow behind them makes it much easier to stay in the new position longer. It is also important to pay attention to the height of your pillow. If the pillow is too high, your neck bends downward and may cause neck or shoulder pain. If it is too low, your head will not get enough support. A pillow with a medium height that keeps your neck and spine aligned is usually the best option. Most importantly, do not try to change too quickly. Start by sleeping on your left side for the first 15 to 20 minutes after getting into bed. Then gradually increase the time each night. As your body gets used to it, the position will begin to feel much more natural without requiring so much effort. Although sleeping on your left side may offer many benefits, that does not mean it is the perfect position for everyone. If you have severe heart failure, serious lung disease, or often feel short of breath when lying on your left side, you should talk to your doctor before trying to change your sleeping position. Some people may feel more pressure in the chest or more discomfort in this position. People with chronic shoulder pain, shoulder arthritis, spinal problems, or those recovering from chest or abdominal surgery should also be more careful. In these situations, the goal is not to force yourself to sleep on your left side no matter what. The goal is to find a position that supports better circulation without making the pain worse. If you have tried changing your sleeping position for a few weeks but still experience shortness of breath, chest pain, dizziness, a racing heartbeat, or worsening leg swelling, it may be time to get checked instead of trying to push through it. Sleeping position is only a supportive tool. It cannot replace medication, a healthy diet, exercise, or the treatment plan recommended by your doctor. But when combined with those things, it can become a small change that brings meaningful benefits over time. Sometimes the biggest difference in your health does not come from a new medication, an expensive device, or a complicated treatment. Sometimes it comes from something as simple as the way you lie down in bed each night. If you have spent many years taking care of your family, worrying about your children and grandchildren, and putting everyone else before yourself, now may be the time to give a little more attention to your own heart, your brain, and your health in the years ahead. Tonight, before you go to sleep, try lying on your left side. If you need to, place a pillow behind your back to keep yourself from rolling over, and another pillow between your knees to make your body more comfortable. Do not force yourself to change everything overnight. Just start little by little. Try doing this for 7 days in a row. Pay attention to whether you sleep better, whether your legs feel lighter, whether you wake up feeling more alert, and whether you have less acid reflux, dizziness, or headaches. Many people only realize how exhausted their body has been once they finally start sleeping the right way. And if you decide to try it, come back after 7 days and share your experience in the comments. I would really like to know what position you usually sleep in and whether you notice any difference. If you found this helpful, make sure to like the video and subscribe to the channel. Because sometimes one small piece of information at the right moment can help someone avoid a life-changing health problem.